How long does it take?
The assessment itself?
Yes.
Yeah. It all depends. And so sometimes with sometimes with a little child who presents, between sort of 18 months and 3, perhaps hasn't yet developed spoken communication and has some of those more clear-cut features we associate with autism, so maybe some little extra motor movements, or just sometimes that diagnosis can be quite clear and may be confirmed within an appointment of an hour to an hour and a half, if there's supporting information from family and from preschool and from grandparents that have seen the child. So if a really clear and consistent picture presents itself, then sometimes that diagnosis can be made quite promptly. With older children through to young adults, people with stronger, sort of more spoken language, sometimes with girls, sometimes it may not be as clear, and sometimes lots of additional information needs to be sought, either in terms of, sometimes that's sort of psychological tests, and other times it's just getting information from as many different people as possible, and that can end up being, and that's probably, it can end up being quite a long process. The other thing is sometimes we say, actually it's not clear right now, and we need to wait and see how someone's development sort of improves over. Thinking about maybe a school age child or someone older, often there's more involved in that process, so they may wait longer to be seen within the public system, and then it's often not clear from a one-off appointment. And the way that we would look to reach a diagnosis would be to collect as much additional information as we can, so as well as from parents and from a child or young person themselves, but also from school and others involved, and then sometimes we need to do some additional testing. So that process can end up quite drawn out, and sometimes does end up taking more like 1 to 2 years.
And privately as well, a lot of the children who are referred are ones where it's not clear, so they're often children who haven't been able to access a public assessment, often because their needs look quite different at school compared to home. So we would also be looking at gathering information from different sources, often observing the child at school, working with the child, doing some more formal assessments. And for school-aged children, there's often learning needs as well that need to be explored, so that can add further assessment onto that. So it's really dependent on what the needs are that the child is presenting with at the time. But generally within the private sector, would be looking at an assessment being done from initial appointment to having a report out between sort of 4 to 8 weeks. So once we get underway, it's a lot quicker to get through the full assessment.
Perfect.